After a post of mine on Instagram on this topic went viral, I had to dig deeper. It's something you probably thought was safe, but is actually massively toxic. Breast implants, and the health risks are huge.
So everybody listen up carefully. If you knew your breast implants would suppress your libido or lead to thyroid changes, how many would do that, knowing the end game could produce really difficult problems with estrogen toxicity based on your genetics, hormone levels that affect your thyroid and your libido?
Early signs that something is going wrong include fatigue, headaches, tight muscles, muscle pain, hair loss, IBS, and various other autoimmune issues. It only gets worse.
The fatigue you experience, the autoimmune symptoms like we discuss, are basically because your system is fighting against something that it can't get out of your system. So it turns on itself. If you're attacking yourself, what's the way to stop it? So if you have an implant, you remove the device.
But there's no need to panic. World thought leader Dr. Rob Whitfield is here to straighten things out. He's removed more than 3,000 breast implants and works with his patients to help them recover and detoxify, which often leads to complete reversal of these issues.
So I did the explant for the patient who had been dealing with mold and Lyme and all the things. She was postmenopausal. She had tried IVF and failed multiple times. She was in her 40s, thought she'd never have a child. I did her explant. She cycled once, got pregnant, and has a child now.
Welcome to the Health Optimization Podcast. I'm Tim Gray, the UK's leading biohacker. This podcast is all about gaining actual advice from the world's top experts and sharing new breakthroughs in nature, biohacking, technology, and longevity research to help you live longer and happier. Breast implants are one of the most common cosmetic surgeries in the US. Up to 350,000 women go under the knife each year. And although implants have increased by 44%, removal has increased by 47%. That means more people are having them out than having them in. But plastic surgeons don't seem to want to talk about the real risks and ingredients. There's been up to an 800% increase in autoimmune conditions for women with breast implants reported. And issues like recurring infections and rashes caused by toxic chemicals. This is called breast implant illness, and it can be totally debilitating. Dr. Rob Whitfield is a world-leading expert in breast implant illness and has been a plastic surgeon for over 25 years. And after years of performing breast implants, an eye-opening realization made him do a 180 on his career. Now he specializes in explant surgery and developed the SHARP program, which helps reduce systemic inflammation and assist patients who are both preparing for or recovering from these surgical procedures. If you're a female and considering getting them or already have them in, or for you guys that love your lady and want to help her decide from a place of knowledge, listen up. Dr. Rob Whitfield, after hanging out several times in different states at different events, it's amazing to have you. So welcome to the show.
Tim, thank you for having me. I really appreciate the opportunity to share my information and experience with your audience.
Tell us about the career-changing moment you had with a cancer patient that made you, pivot from breast implants to breast implant removal.
Right. So I've been an MD since 1996. In 2026, it'll be 30 years of just doing surgery. I spent 20 of those just taking care of cancer patients predominantly. So I did head and neck reconstruction. I did basically any kind of extremity reconstruction. And then predominantly because of the prevalence of breast cancer, both in the United States and around the world, I did breast cancer reconstruction using a technique that involved microsurgery. And that's where I got introduced to caring for patients with breast implant-based reconstruction who had problems, either from radiation treatment, infection, just because they have so many more surgeries. And it was a patient, as you mentioned, in 2016 that came to me for consultation regarding removal of their breast implants after breast reconstruction that I took to the operating room. I did the explant procedure for the patient. And if you go back in our history, like many cancer patients will suffer from chronic fatigue because of bone marrow suppression after their treatments. It's a pretty common problem. It's a really unfortunate problem after cancer therapies. And this patient had fatigue, no other symptomology, no other issues on laboratory exams, blood work, studies. And then after I did her explant, I always do things the same way. I try to take everything out intact because my my sister, who just recently passed away from breast cancer, I would never want her cared for in any other way. So oncologic principles are always followed when I do these. I take them all out as intact as possible, not to spill anything if it's infected or if it has residual cancer. She had no evidence of recurrent breast cancer, which is paramount to someone's long-term health, but she had an E. coli infection. And so somehow I had missed an E. coli infection after 20 plus years of taking care of patients. And I went back through all of my notes to see how I'd made an error or had I missed something. And we hadn't, because at that point, the sophistication of the techniques, the laboratory exams, the studies had not caught up to what I now know.
How has the experience with your sister impacted you in your work going forward? Because obviously that's quite a big motivator to be the best, I guess.
Yeah, it was early in med school when she called me. I think I'd been there less than a month, and she called me and said she had breast cancer. So, I mean, I didn't know anything. I just graduated from university, and I was in medical school, and I just kind of had this moment of like, what the heck am I supposed to do to answer, my sister now? And so that day, the lecturer happened to be a hematologist oncologist, so that I could, after the lecture, I went up to him and I said, hey, I need some help. Can you help me? My sister just called me and said she has breast cancer. And he was so gracious. He said, oh, yes, and called one of his colleagues in the city where she was and helped, because I didn't know anything. I mean, it was basically, what are the medical therapies? What are the non-medical therapies? And my sister is super motivated to not have residual breast tissue. So she had bilateral mastectomies and then reconstruction. And it was later on, as many folks experience, they can have recurrences or metastatic disease. And that's ultimately, she had a pretty long disease-free interval, but then ultimately succumbed to disease recently, this past year.
Yeah, sorry to hear that. Really sorry to hear that. One thing I've noticed in this space, and Dr. Aseem Malhotra is also someone that I'm not sure if you're familiar with Aseem, but he's one of our speakers. He's a leading cardiologist, actually, and both his parents died of heart issues, and one of them was a leading cardiologist as well. And it's really driven him to be the best version of him, to really fight for making sure that these issues don't come up in future. So it's often the motivation is a negative one, but it becomes such a powerful drive for a lot of people making a difference, which is one thing that really resonated with me when we started speaking about how, you really want to change this and make breast implant illness so much more of a thing and understood better. I'm very, very sorry to hear your news, and then the world is really benefiting from it. And I see this quite common in game changers. So, once again, thanks for being on the show, Rob. I really appreciate it.
Thank you.
Can you tell us a little bit more about breast implant illness exactly? And, why do you think it happens?
Sure. So I look at breast implant illness as a chronic inflammatory process of which a breast implant is associated with. Because if you remove the device from the patient, you'll have women experience symptoms of chronic inflammation. So what is happening in our patients is, you and I are bio-individual. We have a genetic makeup. These patients tend to have what's called single nucleotide polymorphisms, or SNPs. So they have mutations in their genetic code which limit their ability to detoxify. So for everybody listening, everything you put in your body, the fluid you drink, the food you eat, the air you breathe, the things you apply to your skin as a woman, contribute to what you have to detoxify. So genetically, you can only handle so much. And then as the years pass and exposures rise, you're going to exceed your ability to detoxify based on your genetic ability. And once that's surpassed, my patients become more symptomatic. Now, there are lots of things, Tim, that go on in between that. Chronic inflammation affects the gut microbiome. So that will then affect everything else downstream. Your liver is your main detoxification organ. So many of those changes occur within the liver. And my patients suffer from not disease that you would see on blood work for the liver, but the functional ability to clear toxins, like a mycotoxin from mold. So we look at those things carefully through saliva for genetics, urine for toxicity burden of environmental toxins like things you've mentioned before, glyphosates that affect our food supply, thanks to people like Monsanto. And then things like gut health is very, very important. There's not one day I go by where somebody doesn't ask me something related to how the gut and the liver are working. So chronic problems with how we eliminate waste, chronic constipation, unable to eliminate, food triggers, so we look at food sensitivities. We're now looking closely at metabolomics to look at end chemical reactions, to look at things like glutathione levels and palmitic acid. And of course, we always look at hormones. So everybody listen up carefully. If you knew your breast implants would suppress your libido or lead to thyroid changes, how many would do that, knowing the end game could produce really difficult problems with both estrogen toxicity based on your genetics, hormone levels that affect your thyroid and your libido?
I mean, pretty much no one. I mean, I think not many people would. I heard a statistic the other day, actually, that a large percentage of people, I think it was 80% of people, would rather not have sex again than leave their iPhone alone, which I think is
Oh
crazy. And the other statistic, as you were saying about, all the products and the chemicals and the total burden, I guess, of all of these things is women apparently are using on average 12 different products a day with on average 168 chemicals a day for the body to deal with. That's over what guys obviously use. So when you have, I guess, implants in that are causing massive inflammation, like you're saying, and all these chemicals, which many of them are untested on humans, like it's a perfect storm, isn't it?
It is. I mean, when you just hear you say it out loud, it's no wonder people come in so symptomatic. So, and then other things will always trigger a problem, a death in the family, other stressful experiences, big bursts of cortisol. I mean, you can just life in general, delivery of a child, moving a home, changing houses, going to university, like all these things add up to the overall, what each of us has to individually detoxify from.
So, Rob, researchers have found an 800% increase in Sjogren's syndrome in women with implants. Can you tell us a little bit about this syndrome and what it is exactly?
Sure. It's an autoimmune disorder where your body's attacking the moisture-producing glands. So you'll get a dry mouth, dry eyes, things like that. So it's a wonderful example of what's going on with the chronic inflammatory process. Like we mentioned previously, so the implants get placed. And it's super rare that it would be a problem in the operating room because of the considerations given by the surgeons and the staff taking care of the patients. So whether it's a hip, knee, or breast implant, it's really uncommon to have a contamination at the point of placement of the device. So this usually happens over our lifetime. We may get a cold. We may have a cut on our skin that gets inflamed. We may get our teeth cleaned and the mouth is full of bacteria. So think of it like this way. Anything that gets in your bloodstream can attach to an implant. The implant has no blood supply. It's been walled off by your body in a scar capsule that your body weaves to protect you from the implant. So in Sjogren's, think of it like this. If there's bacteria on the surface of a breast implant, and through the woven capsule, think of something that's not completely impervious, but can interact with the tissues. It's the interaction with the tissue and the bacterial biofilm that creates oxidation. So oxidation is not actually what we want because then we have to reduce that. And that's how we detoxify it. So this creates a product called oxylipenthenone. So I'm going to give your listeners two pieces of information that everybody who talks about this should understand. 29% of the patients that I explant have bacteria producing a biofilm that can lead to the interaction between the bacteria and the breast tissue. Now, in the breast tissue, there's a fatty acid called oleic acid. That interaction oxidizes that and creates oxylipenthenone. This molecule was found by a scientist looking at this problem in breast implant illness patients. They have higher blood levels of this. This molecule can then be used in a translational research model, so an animal model, and reproduce symptoms of, like we're discussing right now, fatigue, dry eyes. So that's really one of the key findings in research now that now gives you a cause and effect. So if you find this, and we're working diligently with companies to help produce a biomarker test that can be done. But remember, Tim, this is just one aspect. Like, I've been talking about this now for multiple years, and now the literature is finally catching up to the conversation.
Yes, I mean, it's great. I mean, it's better than it not catching up, but yeah, it's great. You've been talking about it for years. So what other autoimmune disorders are there at risk at, and why? I mean, for instance, there's 700% increase in scleroderma. I can't really even say
Scleroderma, yeah.
Thank you. And 600% increase in rheumatoid or arthritis as well. So some significant numbers.
Yeah, I think, honestly, I see more and more of these clients coming in with more and more of these diagnoses. And many of the tests haven't changed over the time that I've been in and out of medical school and in and out of training and in practice. So I think the body's responding. And as we go along, I think these molecules are stimulating the immune response. So all these are downstream effects of our immune system being stimulated by these molecules like oxylipin tinhome and other oxylipins, and then other yet described molecules. Now we're just kind of scratching the surface of what's really stimulating the immune response in these patients. So think of it, I always tell patients, like, the way you feel is like a hamster in a wheel. Your body is constantly running this race and getting nowhere. So the hamster in the wheel is kind of what I go to in this situation. So before I knew what we know now and what we're discussing, I would tell patients the fatigue you experience, the autoimmune symptoms like we discuss, are basically because your system is fighting to get something that it can't get out of your system. So it turns on itself, basically. It starts attacking self. So when patients come to me, and it's not a joke, but so I've done surgery for almost 30 years, including liver transplants and kidney transplants. I spent time in the UK at Cambridge, where they, basically did the first liver transplant. And so we'll just say the last surgeon who won a Nobel Prize won it for doing a kidney transplant in a Siamese twin. Why would that work? Because they're genetically identical. The immune system is identical. You need no immunosuppressive medications. That means for everybody listening, you would need no steroid, right? So if you're attacking yourself, what's the way to stop it? So if you have an implant, you remove the device. Whether it's infected or not, it doesn't really make a difference in this situation. Now, what I find, Tim, is people are super uncomfortable with using the doses of medications that would really suppress the immune system like you would in an organ transplant, because I could make every single person asymptomatic, but they would not want the side effects associated with that much medication, because then you're treated like a transplant patient, if that makes sense.
Yeah. So, I mean, I guess in layman's terms is what I've just heard from that is your immune system is so smart, when there's something foreign, it starts to attack it. And that actually ends up attacking its own body and not knowing the difference between the own body and, a foreign invader. So therefore, the whole time you have something like this the body is attacking itself.
And when we're unhealthy, when we have poor gut health, when we have poor overall health, we see this the most commonly in women with thyroid dysfunction or Hashimoto's. So many, many books have been written about people suffering from Hashimoto's and reversing that just through diet modification alone, like Isabella Wentz has written about many, many times. But so I tell people all the time, like, there are hundreds of examples in my practice of patients without implants who suffer from autoimmune issues. So what is it in their situation? So usually I look 100% at genetics, toxicity burden, gut health, all the same things to help them reverse that.
One thing that I've noticed from people I know in this journey that have had breast implants, they often have low body temperature, so thyroid symptoms, but the thyroid hormones all seem to be okay, but not working correctly somehow, or not interacting correctly.
Absolutely.
And other ones with super high antibodies. What are the indicators? So for instance, when someone walks into your clinic and says, I have breast implants, are they affecting me? Obviously, the answer will be yes anyway. But if someone was to say first 5 or 10 symptoms that they're having, what would you generally hear?
Yeah, so the ones that are super concerning, to your point, are brain fog. So when you have brain fog, to me that's characterized really as short-term memory loss. So you can't remember where you put your keys. You may leave the groceries in the car. Can't remember the kids' names. Can't remember where you're supposed to be. And that's a super concerning, symptom in somebody who has a family, who's younger, should otherwise be very, very high functioning. This is not someone in a position to be characterized as somebody's going to have Alzheimer's or dementia or anything. This is a very young population. Average age could be 35 to 55 in my practice. So you shouldn't see those signs or symptoms in any of those patients. So that's usually the scary thing that gets people. And then overwhelming fatigue. That is like where you can't get out of bed fatigue. And then everybody's like, whoa. What's going on here?
So, I guess fatigue could be, for instance, waking up okay, being tired in the afternoon, needing to go to bed early, not feeling rested with sleep, and then, just generally affecting your sleep throughout, or just literally fatigue through the day.
So that's how it starts. And then I think what you'll, and many men should understand is women push through a lot more than we do normally because they're caring for the family typically and or working and or doing all the things. So they just keep pushing and pushing and pushing and pushing. And then eventually it just shuts down. It's like all systems just go down. And that's when the genetic capability no longer can keep up with the toxicity burden. And then the symptomology of, what we talked about, fatigue, it may be brain fog, it could be anxiety, it could be shortness of breath, lots of muscular symptoms like joint pain, muscle aches. They can have problems with their bowel and bladder function, constipation, diarrhea, intractable UTIs, bacterial vaginosis, all sorts of things just go off the rails. Skin rashes and eczema and all these things that they just keep getting worse. And when you go to the GP, to use the UK version of this, or the family doctor where I am, they don't know what to do with you. And I don't envy a practitioner facing, one of these patients describing all of these symptoms that don't really align. So to your point, Tim, when I listen to somebody, I'm not listening to make a disease classification. One, this has no classification. I'm listening to how you genetically detoxify, what your possible exposures are, how bad your gut health is, what things may trigger you in your food or your environment, and then how goofed up are your hormones? Do you have temperature instability, like you said? Are you cold all the time? Are you just tired all the time? Have you gained a bunch of weight? Is it fluid retention? Or now is it just metabolic syndrome? What's going on that's leading to all this? So I don't sit there and listen to a set of symptoms and try to classify it as a disease.
Yeah, it's a really lovely answer. I mean, again, that's the functional approach to health, isn't it? And then, I think this is actually very similar to how Dr. Dominic Nischwitz, my biological dentist friend, one of our speakers, his approach is he's a dentist. He starts with the mouth, but really it involves the gut, implants, overall nutrition, oral microbiome, gut microbiome, and it's like, well, actually his flavor or positioning is the mouth, and that's where it kind of started from. But yours is again exactly the same approach, but starting from the breasts as the initial problem that triggers the whole other stuff. So it's very interesting to hear you talk about it in such a functional way of all these other important things, and it's not just about the breasts itself. This is like one of the key triggers, I guess.
I think bioindividuality, and we use lots of terms like precision medicine, functional medicine, all these things. Like, so I trained in the traditional model of medicine, and the Genome Project was not complete. I mean, I predate the internet. I used to look at things in a library. Most of you don't even know what that is. They're books and things. And when I used to go to the literature of the world, you had to load it on something called a CD-ROM. Very exciting stuff. So, computing caught up so we could do the Genome Project. So now we have that. And those were to me, the curiosity and what I've always done has been based around understanding genetics. And it's just more and more interesting, the things that we can add to understand better how we are supposed to function than how we do function. based on our exposures and the quality of the air and the food and the fluid. Like people come in and they're like, think they're going to get some huge elaborate surgery explanation. Like, no, I'm going to prioritize your sleep and the quality of food and fluid and air that you use, because those are the things you can change today to modify how you're feeling every day.
Yeah, it's very interesting. I mean, supporting the body with the fundamentals of health. I love this approach. It's funny because it's like, I think, for instance, I had a colleague of mine said they flew back from somewhere or other last week, and they were under so much stress from the time zone shift and their immune system got hit quite heavily. And in fact, one of their teeth, the root canal, flared up quite badly. It's like, well, the immune system's always there tackling it, always dealing with it, keeping it down in the background until something really pushes you. And I guess this leads me on to my next question quite nicely, because it's like, if someone's not suffering with any symptoms at all, do you think they're safe, and what would you tell them?
So I look at it this way, because I have many patients just seek my advice with implants on what they should be doing, should not be doing, screening, etc. And so my SHARP program, the program exists based on what we described in this conversation so far, to look at your genetics and all these other factors, because that sets you up for success. Once you have that, you have, in essence, your playbook. Your control then is, and Tim knows this is very hard, you have to modify your behavior. So the number one thing that is the most complicated thing to take care of a human is modifying their behavior. And in our country, unlike your country, it's not legal to advertise the crap they do to kids about food and drink, etc. And so all we've done in this country, unfortunately, is create a really unhealthy population through the things that are in the food. Like for my patients, it's very simple. I prioritize sleep. You cut out gluten, you cut out dairy, you cut out seed oils, you improve the air quality, the fluid quality, and the food quality. That will drop inflammation. We use a very specific set of supplements that are liquid-based, because many of my patients have, as we've discussed already, gut health issues in the microbiome. So if you give them a bunch of capsules, you're just spending hundreds, if not thousands of dollars a month on things that can't really give you the nutrients that your body needs to enable it to you have to carry out the cellular functions in order to improve your immunity. So we concentrate on things like, vitamin D3, K2, methylated B. We use glutathione. We'll use liposomal vitamin C. So those are just like core things. They seem like, oh, they're super simple. But those are the core things that help support your immunity. And then with the quality of the food and the air and the fluid, those things will all work in concert.
Yeah, no, it's awesome. It's interesting that the supplement's not digesting. It's funny because I often take vitamin C if straight when I need it. And yesterday I was coming down with something quite heavily, and I was thinking, oh, what do I need to do? I need to go and have a sauna. I need to do this. I need to do that. I need to calm down and whatnot. And Simona, my partner, said, you've got a whole load of that vitamin C liposomal. It will work immediately.
That's right.
It's just like, thank you, baby. You're so right. So I had 2,000 milligrams spaced out by a couple of hours before I went to bed, and then 2 on waking this morning, and I'm right as rain, and it's gone, and it's fantastic. And it's like, actually, the story behind the vitamin C brand that I use, and I'm not going to, get into a plug for them, but actually was recovering or trying to recover from cancer, and they found that they couldn't digest vitamin C properly for it to actually have a decent uptake. So they formulated their own vitamin C liposomal, which gets taken up very, very well. And so this is actually what I use today. So
absolutely.
So, to your point, yeah.
I know that if you take the inflammation support package we create, I know that it drops inflammation based on laboratory data and patient experience. So we have to get compliance. And so for everybody listening, like Tim knows how to do this, but I said the hardest thing to do is to get patients to change behavior. One of those is actually supporting themselves with the appropriate nutrients and nutrient-dense foods to help themselves heal. It's
actually the psychology aspect in this. Is super interesting. For instance, there's a colleague of mine, not directly related, that actually has type 2 diabetes. And he said, what can I do to manage this? I was like, well, actually, type 2 diabetes is now known that you can reverse it through diet modifications and lifestyle alone. He said, yeah, but to be honest, I love my food too much. I don't want to do that.
That's classic, mate. That's classic.
He's a very smart dude. And I'm like, but I was like, I really would recommend that you cut out the processed carbs, you do this, that, the other, and get one. And he said, well, I've got a glucose monitor, but to be honest, I don't really want to change. And I'm just like, I mean,
there you have it.
For someone that's very smart, it's like, I can't believe how crazy we are as humans. And so I think the psychological element of getting people on board, I think this is what motivated me early days. Was actually, I had a gun to my head. I couldn't leave the house. I was absolutely just knackered. I was fatigued. Had all these sort of health issues and I couldn't leave the house. And I'm like, I have a gun to my head. I have to step up because I didn't understand what health was or how to do it. I think, and sometimes, for instance, I guess you've seen this with cancer patients. It's like they're really at the end of the road, as in like, I don't know, there's nothing else more motivating than getting my health back now. Whereas it's someone that might have a few symptoms and might have a few sleep issues. The motivation isn't big enough, but in fact, the signs are both there. It's just a different...
Right. If you're taking care of patients, and I saw my sister before she passed away. She was, super malnourished, had lost a bunch of weight, is being ravaged by, metastatic cancer. Awful. I mean, there's nothing, she didn't have other things you could do. These are patients, and we all talk to friends and family, so you can have the conversation with them. Like, these symptoms of chronic inflammation have to do with all the things we've been discussing, food and air and fluid quality. So don't drink out of a plastic water bottle. Don't eat processed foods. I think the kind of underappreciated thing in this is the quality of the air. Like, air quality is a huge thing. So the more you can do that, like, you can only live 4 minutes without oxygen. So everybody understands that who's listening. So think about that. You buy your filtered water, but you don't think about your air like that. You take it for granted that it's always going to be there and it's going to be super clean and it's perfect, and it's not.
Actually, air quality is super important to me. I moved home in London to a cleaner part of the city specifically, and I have actually Jasper air filters around the house now.
From Austin. Thank you.
Yes, I know. They're great guys, actually. So I just had the 3 of them delivered for my apartment, which is fantastic. And it has tells you about the air quality and then goes faster if it needs to if it picks up something. So it really is an underrated hack or health. Even though it is so basic, it seems bonkers. So you've mentioned DNA a few times, Rob. Are there any genes that interest you specifically, or is it just from a whole set of datas that you look into?
Yeah, we have a whole set. The ones that particularly affect women are ones that are associated with vitamin D activation and transport. So I think we see a lot of women suffer with osteopenia and then osteoporosis. So for everybody listening, women, I don't encourage my patients, I actually discourage them from cycling and doing HIIT and high interval training, because as you get older, you want to preserve your bone health. That means you have to lift weights. You're never going to get bulky. So don't worry about that. That's a myth. Those things are important. And then using, like like we were talking about, is liposomal vitamin D3K2. That's simply absorbed, and I know you're going to get it. So if you had to say like, oh, I see that almost all the time in my clients. And then glutathione has been used as, a beauty treatment. It's an antioxidant, but that's really what binds to harmful chemicals in our liver. And people who have problems with specific genetic mutations in glutathione utilization and then the pathways, they have a tough time with chemicals. You may listen to your friends who say they have trouble with chemical odors like strong perfumes or smoke. Those are people who are going to typically have problems with glutathione utilization, and they should be taking, in my just humble opinion, some oral liposomal glutathione to just help themselves.
Yeah, solid advice. I mean, mine are the MTHFR. I have several of the MTHFR and MTRRs and COMT genetic mutations. And, obviously methylated B12, methylfolate, both types of B12 are important for me. But interestingly, I did glutathione tests, and this is obviously, I'm speaking about me as a guy. So it'd be really interesting to see the tests on a female that has implants on the glutathione levels when they have the MTHFR gene variation, because my levels were super low, even though I optimized. So actually I went in and had IV therapy for glutathione in a clinic I go to, IV Boost in London, and I did it twice a week, every week for 6 weeks, and it got my levels back up, and they have maintained there ever since. So I think, from my health issues way back when I was under a super amount of extra overload. My body couldn't cope with it. I got the levels back up and now they've maintained quite nicely. Obviously, supporting the liver is a big part of this, which is where the MTHFR gene is for energy production and detoxification. So it kind of makes sense how this ties into the piece with glutathione.
Absolutely. So if you have, for all the women listening and the men in listening to this who have a spouse or a loved one who may be experiencing these issues, if you have estrogen toxicity, so if the cycle, if the woman has a lot of trouble with her cycle and endometriosis and PCOS and lots of pain, debilitating pain, that's usually because of a specific breakdown product of estrogen called estrone. So there are ways to holistically decrease that with DIM and Chrisin. We have a little support supplement that does that. But if you combine that with the other different genetic issues, that's how you get the worst kind of detox situation.
So I saw some of your content the other day, I think it was on Instagram, where you talked about sauna. And the question posed to you was, should women with breast implants go to sauna?
Sure. I mean, I take a lot of heat for this, no pun intended, because the way it works, Tim, is I had a very famous client, Lauren Bostick, who hosts her own show, The Skinny Confidential, come to me, and she wanted an explant. She felt strongly she didn't have problems with her breast implants, so just didn't feel well, had been doing all the right things, great air quality, food quality, fluid quality, leading a non-toxic lifestyle. And so I said, hey, let's just have you run my program. I want to make sure everything's in order. And lo and behold, she had the worst tox test you could ever have. So she had the highest levels of things like cadmium, aluminum, tin that I'd ever seen in a human, along with some other interesting things. So her husband, Michael, was with her at the appointment. I presented them with the information and I said, what do y'all do? And he said, man, she goes in the sauna. That thing gets up to 212 degrees. She'll do it like 60 minutes, 90 minutes at a time and feel terrible afterwards. I'm like, oh. So we got in a lot of trouble, Tim, to be honest, on her show because the joke was she was melting her implants. Well, for everybody listening, she wasn't melting the implant because you can't reach the melting point of the implant that way. What you can do is cause leaching of the chemicals used in the shell production of the implant. So when you look at her tox test, she has many of the constituents of the shell, the heavy metals that are used in the curing process of the shell. So I did her explant, and within, she'll tell you, waking up, she felt great. I always am a little concerned about that because of medications and things like that. But day over day, week over week, she felt great. Mm. So I take all these out intact, just like I mentioned previously. And when you do that, you don't, afford the luxury of a spillage if it's a cancer or if it's contaminated with bacteria, any kind of spillage. So I did that, took out that encapsulated implant, and then she just basically went and spent the summer in Italy. So she didn't do anything other than have a great time, as you should do on Lake Como, and came back and repeated her tox tests, and all those were gone from her system. So did she do a detox? No, she probably intensified her toxin exposure by, maybe some red wine in Italy. But she was contributing to a letdown of chemicals in her system by overheating herself. So I always caution patients. Everybody asks me, like, what should they do and when should they do it regarding the longevity of an implant? So when I took care of cancer patients and cosmetic patients, I had the same discussions. At 8 to 10 years out, we discuss about exchange because the rupture rate of the device increases 0.5% per year after 8 to 10 years. So I would always have those discussions with patients. Now, I operated predominantly on cancer patients. They had far more problems with their implants than a cosmetic patient. But those are not lifetime devices. I don't agree with anybody with the stance that they're lifetime devices. 2, I don't agree with anybody who leaves a ruptured product in any patient ever. I find that to be holistically just ridiculous. So, for saunas, I tell my patients, please just don't sauna until I do your explant. We'll pause it. You don't have to sell your Sun Life or Therasage or whatever you have. You just give us 90 days and we'll help you and guide you on the way to reintroduce that into your your program, if you will, like Tim has a program, I have a program, you can reintroduce that, but we do not want you to have a Herxenheimer reaction because you're detoxing too quickly. So for everybody listening, if you detox too quickly, you can give yourself basically like flu-like symptoms or feel really unwell. So we don't want to do that, especially in our post-op or patients recovering from surgery.
Rob, so I hear all the time that there's a problem with mold and implants. Like, tell me what's going on.
Our study shows that mold or fungi are not playing a role specifically in the breast implant illness situation. But what I do find is on their tox screen, they have multiple mycotoxins, aflatoxins, fumicins. All these things can be associated with their air supply, fluid they drink. Mold is in coffee, grains. All these things are more of environmental toxins rather than a device-related issue. So I recently published a paper of over 600 consecutive tests done on scar capsules, and it is not mold. It's two bacteria, Cutibacterium acnes and Staph epidermidis, that are playing the role of interacting with your tissues, leading to symptoms. And I just want to hammer this home. Think about it. There's only two ways to fill a device. It's either silicone filled, so obviously those can't have mold in them. And then predominantly what everybody's talked about on the internet is the fluid in the implant having mold. Well, the same fluid that Tim gets at his IV bar with glutathione is the same fluid we put into an implant sterilely in the operating room. So it is not a thing. Stop talking about it. Read the literature. I published a big paper about it. Bacteria is the problem. And in our environment, mold is the problem. So air quality, fluid quality, food quality.
Super interesting. I mean, there's quite a lot of influencers going around having dealt with their mold issues in their homes now. And you can see that they go from big and puffy and water retaining to actually thin and crafted and looking like they've had Botox and fillers and all these things when they actually haven't. So it's so crazy. And in fact, since I've moved house, and I moved around the beginning of October, from an older place where there was actually a damp problem, I found out, to a brand new apartment in a high rise that has clean air and everything, people said I've lost weight. And it's actually quite funny because I definitely had a mold problem in the last house. So I think, you know, environmental mold is such an important thing. And in fact, I'm looking into new testing companies in the UK for this because I think it's such a problem, especially over here. So, Rob, tell me, what's the worst case of breast implant illness you've ever seen?
I will tell you, worst case, most interesting case is a patient who was suffering from chronic Lyme and mold disease. Obviously, I feel strongly that without an explant, it's going to be very difficult for the practitioners who are caring for the patient with Lyme and mold to be effective in their treatments. They may get some relief, but recurrence and flares are very common. So I did the explant for the patient who had been dealing with mold and Lyme and all the things and chronically inflamed. She was postmenopausal. She had tried IVF and failed multiple times. She was in her 40s, thought she'd never have a child. I did her explant. She cycled once, got pregnant, and has a child now. So that is both the worst case scenario, but ultimately the best case scenario that I've dealt with. I think fertility is an underappreciated issue as it relates to implants and chronic inflammation. I feel like everybody listening should understand that it affects your hormones. Anything that affects your hormones, no matter how many hormones the IVF doctor is giving you, it's going to be an uphill battle for you and your system, your body, to cope with that.
So if someone has breast implants listening to this right now, or their partner, and they're thinking, okay, this sounds a lot to take in right now, but they feel that it's something that they should maybe explore, what does the timeline look like? For instance, you know, to a patient coming to you or to one of your colleagues or whatnot, saying, okay, let's start exploring this. What's the timeline look like?
Right. So this is a primer for you. You're listening to this and now you're like, is this really a problem for me or a loved one? What do I do next? So we created long form content in terms of podcasting and our YouTube channel to help you digest more of this information. Basically, what Tim and I have been discussing is just scratching the surface of what I've done over the past 8 years. So you have to educate yourself. Whether or not you come to me is not important. You need to know what questions to ask and how to express yourself to the providers so you can communicate what's going on with your body so they can understand it. Now, if you go into a plastic surgeon and they don't understand this, you need to leave. Don't waste your time. If they don't know how to do this or they say it's unsafe, leave. Don't waste your time. I've been doing cancer reconstruction my entire career and now explants a large majority of the back end of my career. These are not unsafe procedures. They can be carried out and executed by someone who's got enough skill level experience, both in regular cosmetic aesthetic surgery and reconstructive surgery. So you want to get the level of comfort with the surgeon that they understand the problem. Now, they're not typically going to run a program like Tim knows I run in Austin, Texas, where I have a hyperbaric chamber in my office and a 6-foot-tall red light in my office and 3 lymphatic massage devices from New Zealand and a lymphatic therapist. And we have peptide therapy and stem cell therapy. We have all the things that a biohacking clinic would have, except for I have them for my patients who travel from all over the world to have this done. And we published a book to help you better learn about what we've been discussing. So that's called Sharp. That highlights this in a very simplistic way so you can understand how I think about the problem. And then through all the other educational content that's basically free to everybody, you can learn at your pace about the problem.
I've researched this for quite some time now, personal interests for someone close to me. And it's surgery, and surgery should never be taken lightly. And I think anyone listening to this, don't freak out and think, oh, I must get them out immediately. Really do your research, dig into Rob's work, read the book, look on all the podcasts, the YouTube, everything, because it's a big decision. And, as with any surgery, I think it's important you dig deep. And this is part of the reason why I'm digging deep. And I'm actually really amazed with some of the things that I'm finding in the parallels to some of the other things that we talk about, such as biological dentistry, as I mentioned earlier. So not all women obviously get breast implants because they want bigger breasts. As you mentioned, some have had their breasts removed due to breast cancer. And, are there healthier or better ways to get breast implants in those cases?
Right. So what we've done for years is use fat, the original filler, to help augment and enhance the breast. So the issue, Tim, is always, do the patients have the correct health? Do they have enough fat to give them a result? So in someone who wants their own tissue, which has obviously become the trend now, and smaller is absolutely the aesthetic. It's not huge. So that becomes more in line with what patients want to do now who want to live a non-toxic lifestyle. So we offer those fat transfer services. I've done many shows and appeared on shows to discuss it, but that's taking fat typically from, say, inner outer thigh, love handle, abdomen, even arms and other areas, depending on where it is. So in thin patients, I have them get a DEXA scan. People may have in-body in the office or other modalities to look at this to give them more clarity about this. But you want to make sure that you're providing good counsel and not getting someone who's inflamed or super inflamed and retaining fluid, because that'll be confusing on examination. So if I have someone who's got chronic inflammatory symptoms already, we're going to work with them to decrease that prior to ever enhancing or doing a program where we enhance the breast with their own fat. We do that many times under local. So there's no general anesthesia. That limits downtime, enhances recovery as well.
So I heard a few days ago that there's a new implant methodology, which is doing an incision near the armpit. And I'm not sure if you've heard of this yet, but I'm wondering if you think that's safe or it's just another alternative to normal breast implants.
Yeah, so there's 3 access incisions under the breast, around the nipple complex, and through the armpit. That's actually not super new. The thing with that incision is if it's done without the aid of visualization, like a scope, something that give you better visualization, it's going to be associated with more position complications. So you'll have what's called malposition more frequently. It would have a lower, typically, infection rate. But the safest and most precise way to put them in a cosmetic situation is under the breast. If you go through the breast, you're going to contaminate more frequently because the ducts of the breast will have colonization of bacteria like we've been discussing.
I heard recently also that there are other benefits to having your breast implants taken out and obviously losses from having them put in. And one of them was, interestingly, the nipple connection to the pituitary gland. So, and I'm not sure if you're familiar with this or not, but it's a very interesting concept I heard is where women have had breast implants put in, it distanced the length of the nerves from the pituitary gland. So therefore they have less connection to their breasts and therefore can have less emotional response from them. Is that something you've heard of?
Yeah, and that happens typically from a larger device being placed, especially in a smaller patient, a smaller breast size, and the stretch. So that is a reality, and many patients come in and we always ask them, do you already have decreased or what's the sensation level? And many of them will remark it diminished afterwards and didn't completely come back.
Yeah, interesting. Yeah, and I also heard about an emotional disconnection in terms of personality and rapport with other humans as well. So that's something that I'm going to be digging into further. So I'm not sure if you're familiar with the emotional connection, but that's also...
Well, we have a lot of patients who have, and they don't feel really well. So we do have them concentrate, and we have different programming to help with mindset. Because although I can do all this surgery and have all this sophistication around our program for recovery and detoxification and publication of books and podcasts, I can't change your mindset. That's something you have to work on and do your own self-work before you show up, because that will undo you if you cannot break the loop in your insula, in your brain, that you're chronically inflamed. We have to get people out of that mindset.
How quickly, for women that have had their breast implants removed, can they begin to recover, do you think? And I'm talking obviously from the surgery and from the chronic inflammation and, other health issues that they've had. Right.
So we're going to take it in two parts. I put a lot on how they genetically detoxify, and I put a lot into their toxicity burden and gut health. So we'll just take those. And if you already detox poorly, it's typically going to take longer. So if you have a really bad tox test, sometimes those two correlate, sometimes they don't. But if you have a lot of environmental toxins, phthalates, glyphosates, if you have a lot of mycotoxins, aflatoxins, fumicins, if you have a lot of heavy metals, it's going to take longer for you. So what's unique about my program is we do all that testing, create a detoxification program that runs in parallel to our surgical recovery program. So that's ran by my functional group, and they're working with patients in a holistic way to detoxify them. So the patients who have infections and they may have ruptures and they may be suffering more consequences from just having the device in, that burden gets removed. So that's just one component. The other is everything else that's going on with them physiologically.
Amazing. So how does your SHARP program help patients recover specifically?
So, it's great. When I look back in the history of operating, I'm like, why did this patient not do well and this patient did so well? So now the reason's obvious. The SHARP program is basically our way to employ strategy to holistically recover you in as quickly a possible manner. And that methodology, we look at your genetics principally, your toxicity burden, all the things we've been talking about to create your detox plan. Because once you have that, Tim, then you can make changes both personally that affect you physiologically, emotionally, and ultimately professionally.
Amazing. And finally, how do you feel now knowing that you've helped so many women and are helping many more recover from something that's caused them so much pain for so long?
I think we're in the business of making as much change as possible to as many lives as we can. So the women who've been, quote unquote, disenfranchised by this or gaslit by this is a real problem. And we have real evidence behind it now. So there is no longer this pretense about it. And so we've published all the work about how frequently bacteria is involved. More work has been published about that molecule, oxylipin-10 that leads to symptoms. So nobody can say this is not a phenomenon anymore. This is not generated by the internet. This is not a social media phenomenon. This is a real problem that exists in these patients, and more will be able to identify maybe other molecules or other modalities to help them.
So how does that make you feel?
I don't think the job's done, so I don't feel super, fantastic. I feel better. Now we can really talk with clarity about the subject and help more patients. I can only operate on so many people. We're going to work hard to level up with other practitioners and other surgeons to really provide the most we can for these patients.
So now all the research is there and everything's coming together and it's becoming more obvious and documented that these are a problem. I've got one question for you, Rob. Have you made it to Quack Watch?
I don't know. I was called a quack recently. I thought so that's kind of being on Quack Watch, I guess.
It means they just don't know what science means, doesn't it? Let's be honest.
That's funny. Yeah. That happened at a fundraiser I was at. Somebody called me a quack and I literally punched them in the face.
Take it as a compliment. Take it as a compliment because, as you know, a lot of these people that are called quacks, all the stuff's come out and it's proving them that they've been right in a lot of it. So Rob, Dr. Rob Whitfield, thank you so much for being on today. It's been a pleasure to run through so many angles of breast implant illness with you. And I'm looking forward to seeing you again soon stateside.
Hey, thanks for having me on, Tim. I really appreciate it.
A massive thank you to my guest and friend, Dr. Rob Whitfield. Learn more over at drrobwhitfield.com. You've been listening to the Health Optimization Podcast, and I'm Tim Gray. Comment and leave the video a thumbs up if you enjoyed it, and subscribe to my channel to see more. See you next time, and remember, please let's spread the health.